hard for me to take a shower because I was so out of breath. My lung function was at the time like 18%. So that's 18 out of 100. If you can imagine, that's a very small amount of air to move in and out of the lungs and to be able to function and live my life. So
it seems like the lung transplant is like the last resort for everything.
that's right. So when that's at the point that lung transplant is seriously considered and then performed. It's basically like choosing the optimal window of time where the body is still healthy enough to go through with such a major surgery, but also sick enough that, you couldn't go on too much longer.
It sounds like your body's like telling you to do one thing and you're like, no, we gotta like slow down
Yeah,
here.
I know. It's difficult to accept it. It's just a machine. It's like probably like a 10-pound machine, so it's not even that light. Like, if you think about it, like
Oh,
if I'm having to carry 10
that's heavy.
pounds and then I'm using more energy to then use the oxygen. And then, I wear it like through like a nasal cannula. So like goes in your nose and then
Yeah.
like that.
Okay.
I mean, I can show you if you want.
Yeah,
Okay.
sure. So you say you're like 30%. So I'm guessing, let's say you got a lung transplant, you will be at like, let's say 90 to 100%. But over time, your body will slowly attack it and you'll slowly lose the capacity again.
So,
Is that fair to say?
yeah, like I said, I'm kind of teetering on that, very much teetering in that balance of
Yeah.
healthy enough to not need the transplant, but also knowing that it's not that far off.
Because everybody knows going to a hospital is intimidating and absolutely draining. What advice do you have for someone who is not as fluent and I guess strong enough to stand up for themselves in these stressful situations?
Give them grace too. I think, every one of us are human. We all have things in our lives, they may have things in their personal lives too that they're dealing with that unfortunately may bleed into or reflect on the way that they interact with you as the patient. So this is, I guess, a nebulizer vial. That's what it's called. And so I put.
So you vape then?
Right.
You're a vaper. I mean, I guess it sucks for you because like you are forced to bring like less shoes and clothes. You have to bring all your medical
Yeah,
equipment,
I often
right?
sometimes I'm embarrassed that like, all my friends they just got like a little carry-on thing and you know, they have extra space for all of their like, hair.
And here comes Ella. So I have here you need 40% lung capacity to participate in clinical trial, and you have about 20 to 30%. So like, are you kind of screwed in terms of finding any treatment for yourself?
Yeah, that's right.
What is something the doctors or researchers seem to always get wrong, hence why you have a job in this field?
It's a good question. I like that a lot.
Hello, welcome to my podcast, Two Mics, One Joe Stooge. I am Joe Stooge, and I'll be giving a mic to Ella. Ella is a patient advocacy and engagement consultant. She always wanted to study volcanoes, but her life got sidetracked dealing with cystic fibrosis. It is a rare genetic disease where it causes problems in her lungs and digestion. She was diagnosed since the age of 1. In 2019, she was out of option and tried a not study treatment called phage therapy. Let's talk how you possibly saved your own life when you discovered the treatment yourself.
Thanks for having me on here this morning. Be happy to talk about that experience. A little background that don't really know, cystic fibrosis is a disease characterized by the buildup of mucus in the lungs that causes infection and inflammation, and this trapped bacteria that I breathe in from the air then causes these infections that require antibiotic treatment throughout my life. And over time, these infections lead to antibiotic resistance because of the many, many antibiotics that I've had to use throughout my life. And so in 2019, I got really sick with one of these infections, and I was on intravenous antibiotics for a number of weeks, and it wasn't helping my situation at all. I was doing these breathing treatments constantly. I was on supplemental oxygen 24/7. It was even hard for me to take a shower because I was so out of breath. My lung function was at the time like 18%. So That's 18 out of 100. If you can imagine, that's a very small amount of air to move in and out of the lungs and to be able to function and live my life. So at that time, around that same time, I happened to come across a documentary where another person living with CF was being treated with this experimental treatment. And this treatment is called phage therapy. And what that is, and I did a lot of research at that time and looked into it, and I was like, I need an alternative to antibiotics, and this was going to be that. And so I contacted the researchers to find out more about this treatment, and it's not currently an FDA approved therapy. It's experimental, and it's the use of a very specific virus that attacks a bacterial host. So it would be killing off the bacteria in my lungs and not, like another type of virus that attacks like my body's cells. So, I connected with these researchers and I decided that I wanted to pursue this and try it. So I was able to, with the help of my parents, my family, I was able to travel up to Yale to receive this treatment. I was up there for a couple of days, and it was effective in treating that acute infection. And this experience really made me realize the value that I had in my own care, and like taking the initiative to find out about these treatments, pursue it, and learn about it to then be able to make an informed decision to be treated by it with it. And so from there, I wanted to share my story, my experience with being somebody that did receive this therapy and did benefit from it, and just bring more awareness to it in particular, but also to serve as empowerment or inspiration for other people dealing with disease to be able to take more active roles in their care, and take on these sort of initiatives and be more informed about research and about trials, and like I said, just be these partners in care. And so that's my mission now. One of them is to...
I'm gonna stop you right there because we're gonna dive into your patient advocacy later. I want to talk about more like
Okay.
you right now. So we established phage therapy to help you. So was a lung transplant ever in question?
So at that time, yeah, okay, hold on. Was a lung transplant ever in question? Yes, I had been referred to get a lung transplant a number of years ago. I have been dealing with low lung function for over 10 years of my life now. I'm 30 years old. And the first time I was referred to get a lung transplant was when I was 20. And I went down to Duke University. I live in Richmond, Virginia. And I went to Duke University and did the whole workup, for it, did a lot of testing. At the time, they deemed me too healthy for a transplant. But then in 2019, after I got very sick with that infection, although the infection cleared and I was able to fight it off, my lungs were very scarred and diseased after that. So I, didn't regain a lot of lung strength. I was still using oxygen a lot. I was still, although dealing with less infection, like the underlying damage to the lung is still there. And so I was then referred to get a lung transplant afterward. I went down, so that was in the spring of 2019. I went down to Duke University again. I moved down there to be involved in the process. So I was doing a lot of testing in the program. As part of the program, every day I had to do exercise like pulmonary rehabilitation. And then later that fall, in around September, I got access to another treatment that was FDA approved to treat the underlying cause of the disease. That's a medication called Trikafta, developed by Vertex Pharmaceuticals. And it had been in clinical trials for a number of years, but finally it was going to be approved, and I was able to access it right in the late fall of 2019. And it did help to stabilize my lungs. And so then in the last couple of years since then, I've, dealt less with infection, although I still have that lung disease, underlying disease. I don't have as much volatility in my day-to-day symptoms. I'm able to go longer periods of time between having to do these treatments throughout the day. And, it's just pushed off transplant for a couple more years, which, I'm really grateful for whatever I can get, really.
So it seemed like the lung transplant is like the last resort for everything.
That's right. So when the lungs are so diseased that, a person cannot conduct their day-to-day life as needed, they have when they're so limited by the lungs, and that, I'd be using oxygen all the time, really be able to have a lot of energy to live my life and do what I want to do. That's at the point that lung transplant is seriously considered and then performed. It's basically like choosing the optimal window of time where the body is still healthy enough to go through with such a major surgery, but also sick enough that, you couldn't go on too much longer.
That's a small window, though. Like that's such
It
a small
is.
window.
It is. And the doctor, of course, my healthcare providers, I'm monitored very closely. So, they're aware of where I am in my health, and, they're basically, whenever the time came, we would be ready to proceed.
So you say like your lung capacity or lung function dropped to 18%, and I'm assuming you're in like decent health now. So what capacity is your lungs
It's a good
now?
question.
Like what's your baseline?
Currently, it's not that much higher, to be honest. When I got on that treatment called Trikafta, it bumped up to like 32 or so percent. But so it's not
Okay.
not that much higher. But I think what it is like my body has just been accustomed to functioning on a smaller amount of lung capacity for so many years that, like, the body is an amazing thing. It really just, it adjusts, and it, adapts to the environment. And so it adapted to using less oxygen than needed, like just being more efficient in what my body, in what my lungs could provide. And so currently I have like 27, 26%. So still very low. And, to put it into a little more perspective, like I still use supplemental oxygen when I'm exercising, when I'm sleeping, because those are times that I'm, using more oxygen, or like at night you're breathing more shallow. So you're not getting as much air.
Wait, really?
Yeah.
At night? Oh, I thought your body would be more like
Yeah,
relaxed.
we would think, but
Okay.
yeah, exactly. You're more relaxed, so you breathe more shallow, and so you get less oxygen. And so,
Oh,
yeah,
okay.
so at those times I still use it. And like, I can't run or, do a lot of physical activity. So I walk, of course, but even like hills and stairs are very difficult for me. Like I get very winded. I'll always opt for the elevator and not a staircase. And, sometimes with friends too, I have to be like, hey, can you guys slow down? I can't walk that fast. And of course, they do, but I have to
so
remind.
so no rock climbing for Ella today?
No, I love to rock climb. I really do. And I've done it, here and there recently, but basically like if I go up one rock climb, then I'm like really tired for a while, so I need to like rest. And I definitely push my body. Like there's no question that sometimes I'm
Mm-hmm.
pushing it probably past
Yeah.
the point that I should be, and that can obviously have some detrimental effects with, putting more strain on my heart, because the lungs are having to work so hard. So then it like makes the heart have to pump more pressure. But overall, I think it's only made me the drive to like push my body has helped me to keep going.
Mm-hmm. Yeah. It sucks,
Yeah.
right? It sucks that your body's like telling you to do one thing and you're like, no, we gotta like slow down
Yeah.
here.
I know. It's difficult to accept it.
Do you say like you gassed out? So do you have like oxygen on hand on the side, or you did more like you did out of breath and just gotta catch your breath again and you're fine again?
So yeah, once I stop moving, if I go up a flight of stairs and I just stand there for a while, I will regain, normal levels of oxygen and regain my breath, of course. There are times that I have a portable oxygen concentrator, and I do take that with me sometimes, depending on, how much activity I'm going to be doing. But it is
like when like when a diver goes swimming, they have like a thing. It's kind of like a mouthpiece, but it's like a pole. It is something like that,
it's
so like they can like go diving without like the
yeah,
backpack thing.
so yeah, it's not like on me a backpack, but I mean you can wear them, but I just have it it's just a machine. It's probably like a 10-pound machine, so it's not even that light. If you think about it,
Oh,
if I'm having to carry 10
that's heavy.
pounds and then I'm using more energy to then use the oxygen. But yeah, so and then I wear it through a nasal cannula, so goes in your nose and then
Yeah.
like that.
Okay.
I mean, I can show you if you want.
Yeah.
Okay.
Sure. Let's do it.
It's actually right here.
Yeah. I mean, you don't have to lift it, but
No,
you
I
can.
won't show. I mean, the machine is just on the ground, but this is the
Mm-hmm.
the hose part. So just put it like that, and then oxygen's going in.
Okay.
So yeah, that's it.
Well, you got your thumbnail right there.
Perfect.
So thank you. So like, do you have any fun stories where you're like, I should not be gassing out right now, but I'm totally gassing out
I
right
should not
now?
be what right now?
You're gassing out.
Gassing out.
Like you shouldn't be this tired.
Oh, tired.
Yeah. Like you shouldn't be this
Yeah,
tired.
yeah, yeah. That I shouldn't be this tired. Is that what you're saying?
Yeah. Like sometimes I don't know, some situation where like you should not be this tired and you're just like dying almost.
No, I don't know. I don't know if I have an example. When I am tired, usually there's a reason for it. I've definitely pushed my, like I said, I push my body, and I try to, for exercise, I try to do HIIT circuits. So high intensity interval training. So with 10-pound weights, 10 to 15-pound weights, lunge circuits and squats and, arms over your head, things like that. So when I do that, I do get very tired and very out of breath, but it's a good tired, it makes, I feel like I'm
Yeah.
making a difference and improving my lung capacity too, and my strength.
So you say you're like 30%. So if you, so I'm guessing, let's say you got a lung transplant, you will be at like, let's say 90 to 100%. But over time, your body will slowly attack it, and you'll slowly lose the capacity again.
So
Is that fair to say?
basically, if when I get a lung transplant, those lungs that I get from another person will not have cystic fibrosis in them anymore. So I won't have any of that mucus buildup or any of the lung deterioration from CF.
Oh,
But because genetically, right, genetically that lung will not have the defect in the cells that CF does.
that's crazy.
So, but yes, over time, it's possible, and it will happen at some point. It's just a matter of time. Our bodies, so when there's something foreign in our own bodies, right? That's when our immune system attacks it and wants to fend it off, right?
Yeah.
And so the same thing can happen and does happen eventually with transplanted lungs. So when you get a transplant, you have to be on immune suppression. So that means that your immune system in general, your whole body's immune system has to be suppressed artificially by taking pills, so that it doesn't attack the lungs and destroy them. So, there are things that can trigger this rejection to happen sooner for some people. If you do get an infection where, unrelated to the lungs or in the lungs or whatever, and that infection maybe ramps up your immune system, then it can recognize the lung and be like, oh, gotta attack this too. So that can lead to rejection. But over time, yeah, it's just, there's some level of the immune system fighting the lung even to a small degree over time. And that can just, cause damage over time and then lead to a loss of function. And then eventually, respiratory disease again, where you're needing oxygen and you can't breathe. But it's a different
That's an awful
cause.
catch 22.
Is that sorry?
Yeah, that's an awful catch-22 for you.
Yeah.
Like your life would improve a lot, but like it also will like there's the cons to it, and it's like it's like worth it in some ways, but it's also at the same time not worth it. I can totally see why you wouldn't. Well, you want to do it, but I can see why you wouldn't want to do
Yeah.
it either.
I view it as I, yeah, of course, you can think about the bad things too, but ultimately, I just view it in a way that I know that it will be prolonging my life to some degree.
Mm-hmm.
So to me, because of that, it's worth it.
Just not right now.
Yeah, hopefully not right now. Yeah, like I said, I'm kind of teetering on that, very much teetering in that balance of
Yeah.
healthy enough to not need the transplant, but also knowing that it's not that far off.
So I'm just gonna reiterate some points that Ella made earlier. So she was basically in a life and death situation with the free therapy. Throughout her life, she was on oral or IV antibiotics, and nothing was working. You were on oxygen and needing to do breathing treatments every 2 hours. And your week say, I am surprised you found a treatment to save your life versus a doctor of hey, let's try this treatment out. Like you were the advocate for yourself. I'm just surprised, like since you were weak, that you were able to like fight for yourself, because we all know like going to a doctor's office can be pretty intimidating, especially when you have like, hey, let's try the treatment now, and most likely it's the doctor telling you. So I'm surprised just for you being weak and standing up for yourself is pretty courageous. And then like your doctor like, hey, let's do this too. That's like insane almost. That's almost unheard of.
It wasn't just, it was a progression over time, right? Like throughout my life, I've over time learned the value of self-advocating for myself. So when I transitioned from pediatric to adult care, that's when I started to take on more responsibilities in, managing, going to appointments by myself, talking to the doctors, talking to the pharmacy. Even when I was in the hospital, I was making those decisions together with my healthcare providers. Like I've always had like a good doctor to patient relationship where I felt comfortable in raising my opinions and sharing my thoughts on what is best for my care, because I am so in tune with my care and understanding what my body needs. That helps me to be more confident in what I know about my health and what I think will be best. And so that obviously has come also from, time in becoming better attuned with my care and being more confident in sharing my perspective and feeling like it is a partnership in care with my doctors and my care teams.
This situation led Ella to become an advocate for rare disease patients and also doctor patient relationships. Me being a rare disease area, the patient had to be strong advocates because everybody knows going to a hospital is intimidating and absolutely draining. What advice do you have for someone who is not as fluent and I guess strong enough to stand up for themselves in these stressful situations?
I would suggest a couple of things for people that maybe aren't as confident or know enough about their care to make these decisions together. One, I would say just be open with your doctor in sharing, even things that you don't know, things that you want to understand more about. Ask those questions. Don't be afraid to ask them so that you can get that understanding and that awareness to then in the future make those decisions together. So I think it's really important to start there. It's really important to educate ourselves outside of what our doctor says. Do research, look up some things, some terms that they talked about, or some medications or some clinical trials. Like do your own research on that and get that information for yourself. And maybe, you will be taking that, at your next appointment, you can take new information to them, something that they don't, something that your doctor doesn't know about. And that is the beginning of that collaborative, partnership relationship. I'd also suggest, viewing your care teams as allies, not adversaries. I think oftentimes this patient to doctor relationship can be not the most pleasant. It can often get off on the wrong footing, and that can like lead to just a negative experience in the future overall. But,
Mm-hmm.
kind of think that, give give them grace too. I think, every one of us are human. We all have things in our lives, they may have things in their personal lives too that they're dealing with that unfortunately may bleed into or reflect on the way that they interact with you as the patient. And don't necessarily view that as like an attack on you or like something, that they're directly, that is about you or that they're trying to be mean or anything. But, just view it as maybe there's something in their life too that they're dealing with. Let me voice my thoughts and let me turn this conversation or this interaction around by just being transparent. And hey, I feel like maybe I'm not being listened to all the time. Can I verbalize my thoughts here? And so that makes somebody, stop and think, oh, okay, let me hear what they have to say. I realize I haven't been very open or, attentive. It just brings the attention to that. So those are a few things that I would suggest with just starting with to build that better relationship and, to then come to to become a relationship of collaboration and partnership.
Would you be down to do a breathing exercise and walk us through the regimen?
Yeah, absolutely. So this is, I guess, a nebulizer vial. That's what it's called. And so I put this liquid medication into it. This is called albuterol. And this opens the airways so that I can cough out the mucus easier. And I do this like 4 times a day. So I just open it and then I pour it into here. So you just like squeeze it in and then put the lid on it. And then so then I turn on the machine and then you put the hose in it and this like pushes the air out. And then you breathe it in. And I do this it lasts about 15 minutes. And sometimes I have to do pour other medications into it as well. To some of the other treatments, just thin the mucus. So this one opens airways, some thin the mucus, and then some hydrate the lungs to then allow the mucus to be more liquid and to move easier.
So the nebulizer, it pushes air and the medications into your lungs?
Yeah, so the nebulizer, it pushes air through here and then it aerosolizes the liquid. So then it becomes a vapor.
Okay. So you vape.
What?
So you vape then.
Right.
Oh, that's cool. So you have to do this 4 times a day, and do you have like a timer, or do you kind of like feel bad and then like I gotta do this, and then you feel
Yeah,
better?
like once I, after a few minutes, once I'm breathing it in, I can feel my airways open. Then I don't need a timer because when the medication is done, nothing comes out here. So I know when it's finished. And also I feel like I can breathe easier. And then I also, like I said, have to cough out the mucus. So that's the only way that I can leave the lungs is by coughing it out.
So this is like something you have to bring with you if you travel anywhere.
Yep. So it's a lot of, so I take a number of these with me because they have to be cleaned after each use. So I have to boil them to disinfect it. So that kind of takes some space. And then the nebulizer itself is a machine about like this big.
So so if you travel, you have to bring the oxygen thing, and so that's like what, 15 to 20 pounds right there. I mean, I guess it sucks for you because like you are forced to bring like less shoes and clothes. You have to bring all your medical equipment.
Yeah, I often sometimes I'm embarrassed that like, all my friends, they just got like a little carry-on thing and, they have extra space for all of their like,
and here comes Ella with everything.
Yeah, like all their curling irons and all these shoes and all this stuff. And then I'm here with like all this medication and my suitcase is like stuffed full and they're like, you travel with so much stuff. I was like, well, little do you know.
Yeah, I mean, I guess your friend would know because like the oxygen machine, it's kind of hard to like hide too. Like you have to like.
They do, yeah. And I'm being facetious, but yeah, they all know.
Are you like embarrassed in terms of like, do you like go, like, let's say you're traveling, do you like to go to the bathroom, or do you like to go to your room and just do it in private? It's kind of weird when you have a thing in your mouth just sitting there for 15
Yeah.
minutes.
So let's say, I go somewhere overnight with friends and we're, in a hotel, whatever. Yeah, I just do it in the room.
Yeah.
No problem. They do their own thing while I do it. So, and I usually always like to plan it out with them. So like, obviously I have to do it in the morning, which takes a pretty good chunk of time. And so then I'll be like, yeah, okay, I'm going to do my treatment. You go get breakfast or go to the coffee shop or something while I do that. Or they can, like, I'm not saying I
Yeah.
feel uncomfortable with them being there, but just to like, I'm somebody that always likes to like optimize time. So I'm like, you don't have to sit around
Okay.
waiting here for me. Like, I'll meet you, wherever you are or whatever.
I think they should just try to make it quieter though, so it's more like conspicuous, I
Oh,
guess.
the machine, the sound, the loudness of the machine. Yeah,
Yeah.
it's
It's like
it's
a.
just because it's a compressor. So
Okay.
basically what it does is it sucks air from the atmosphere and compresses it so that it can have a lot of pressure coming through that hose.
I wonder if you like went to space and you were like in a spacesuit, like would you like never gonna affect it again because you're breathing like pure oxygen?
Wait, what are you saying? Sorry, say that again.
Like like when you go to space and you have the spacesuit on, they give you like oxygen because you can't breathe in space. Like would you like never get an infection again since you're breathing like pure, unaffected, on no virus oxygen?
I mean, I guess, yeah, I think, I don't know. I never thought about that. I think I would breathe okay because I would be getting oxygen just like others, right? So basically, the reason
Yeah.
I can't breathe as well in this air because some 70 some percent of it is nitrogen, so only like 23 or whatever
Mm-hmm.
percentage of atmospheric air is oxygen. So if that was concentrated, where it was 100%, then yeah, then I'd be breathing a lot better.
So I feel like everyone understands that cystic fibrosis is going to be a constant in your life, even with a lung transplant. So I have here you need 40% lung capacity to participate in clinical trial, and you have about 20 to 30%. So like, are you kind of screwed in terms of finding any treatment for yourself?
Yeah, that's right. So I unfortunately am not able to participate in any new treatment trials. So when it comes to new developed therapeutics, because of that, and that's just like an across the board exclusion criteria that all companies pretty much just adopt when they're creating new trials. And I've done a decent amount of advocacy in this space to bring more awareness to the need for augmenting clinical trial designs to be more inclusive of broader patient populations because you know the idea behind it is that people with less than 40% are more unstable in their health. They could be more, obviously they're more sick. They might have more volatility. They may become very sick if they're on the treatment during a trial. They may pass away, so there's a more like uncertainty. So they just like have this blanket criteria at 40% that was like, okay, well, above that, people should be healthy enough. But I think there are many others like me who have had low lung function for so many years, but we are healthy in our care. We're very vigilant. We know our bodies. We've been maintaining it. We've had around the same lung function for many, many years. And, I'm a part of a population that is stable in their health, that would be considered, I think, ideal for a clinical trial. Granted, I would not necessarily see the same level of improvement in lung function like somebody with
Hmm.
starting with a higher percentage of lung function already. So when it
Yeah.
comes to endpoints, accumulating clinical trial endpoints and understanding what the improvement of FEV1, which is measure of lung function, is, they won't have as great of positive results. But that's why I think it's really important to use different endpoints or have a separate arm of a trial where they're including a population with lower lung function, just to like, first, it's just important to understand how a treatment is going to affect this population, because currently there's no data from that. So, you know, there's a number. So I've written a lot of, not a lot, but I've written a couple of articles about this topic and have had them published. And so it's something that I'm always kind of pushing for whenever I get asked to review like a clinical trial protocol. Always the exclusion criteria pretty much is always at 40. And so I always give feedback on that and, just kind of bring it up as a point of conversation.
So is this that the clinical trial, older medicine, is it safe to say your lungs will never really get better? Is it more preventing your lungs from getting worse?
At this point, you're right. That's right. So, because I've had so much lung disease for such a long time, it wouldn't really get much better. Like with Trikafta, I got up a few more percentages, into the 30s. But beyond that, no. That disease is already basically the tissue, the lung tissue is just dead. And so it's not going to be regenerated because it doesn't. That's not what the lungs don't do that. The lung cells don't regenerate. And so basically, even if there were to be a cure for CF or even just genetic therapeutics, so gene therapies, obviously those are new in clinical trials now. Even with that, that doesn't reverse the dying in dead tissue. So I am also an advocate for, pursuing stem cell therapeutics where that tissue can be, reversed or improved on for people like me who, and many of us with CF, other diseases too, who have underlying damage and disease to their organs that need stem cell therapeutics to improve that, to then be able to use these gene therapies at a full lung capacity. So it's really, I think in my opinion, there's not enough focus on that, especially in CF. I think everybody's just focused, gene therapies and a cure is gonna erase all of CF, but it's not going to for those of us that have this underlying lung damage present.
Yeah, I mean, it's kind of similar to my disease. Like all the clinical trials are there to halt it, but it won't help ourselves as much anymore, which is unfortunate. Now that we advocate more so the kids don't suffer as much as we did.
Exactly.
It's kind of like it's great, but it's also like that at the same time. It's like, why couldn't I be born like 30 years earlier?
Yeah, I feel you.
Yeah, I want to add to the so you say like the 20, you're at 30%, and the clinical trial cap it at 40%. So you're kind of looking maybe for like an asterisk, or maybe like we accept 40, but like maybe you have to sign like extra paperwork since you're a lower percentage. Like you still want to be part of the trial and still want to help. Like it's just like an asterisk of, I understand what may happen, but it's at the end of the day kind of up to you if you want to take that risk or not. If you're upfront with the facts.
That, or even just incorporating, having a separate arm of their trial where maybe the data that's collected from people between 40 and 30% FEV1 isn't a part of the analysis for the standard part of the trial, but that data is still collected and it still can be submitted to FDA for support of, data for approval of that drug. So maybe it's not skewing, the original data set, but it can still be captured and used. Or, also having like open label clinical trials where, they allow access to the therapy, once during the trial or after the trial too. Because I think that's another part of this is that, and I'm sure you know this too, when the clinical trial concludes, then it takes time for that medication, if it's going to be approved, it takes time for it to be approved. And in the meantime, people are not having access to a treatment that potentially could be very beneficial. And that's the thing is like with, genetic diseases, chronic diseases, like time is of the essence. We don't have, we deteriorate as time goes on. So, we need therapies as fast as possible. So we don't have time, to be sitting around waiting for these approved therapies for years. And that's something that was really like frustrating to me before I gained access to Trikafta, that medication that I started, it was in trials for, the previous 3 years prior to that. And I had begged them to allow me expanded access, which is an early approval, an early access to the therapy based on health need. Because I was somebody that was very, low in lung function, had a much higher need for this therapeutic. I tried to apply for that, but they were not allowing it.
It's safe to say that that you were really lucky with phage therapy not be on a clinical trial, because if it was on a clinical trial, you would have no access to it.
You're absolutely right. Yeah.
So it's safe to say that Ella has become a huge professional patient voice and research, contributing to clinical trial development, research prioritization, and committee developing patient engagement initiative. What is something the doctors or researchers seem to always get wrong, hence why you have a job in this field?
It's a good question. I like that a lot. What they always get wrong, I think they just oftentimes don't get the full picture. I think there's so many nuances to diseases and disease populations, whether that's CF or other, that often I think are overlooked and aren't really considered when it comes to the design of trials. Like, for example, I was recently reviewing a clinical trial protocol where they were going to be asking patients to do the breathing test to measure the lung function in the clinic in the morning prior to doing any of these therapies in the day. And then you could do the therapy afterward. And I'm like, that doesn't make any sense. I personally could not be able to breathe and do a breathing test without having done this first to clear the mucus and open my airways. And on a normal day, I wouldn't be doing a breathing test before doing my treatment anyway. So why should it be different for a clinical trial? Don't you want to capture as much of a normal assessment as possible to get to, to be able to see the effectiveness, like in that way, where to be standardized basically in the same way that any other data collection would be, any other data from, a breathing test would be collected on a normal day. So it's things like that. And they're like, oh, okay, yeah, I guess that makes sense. So, it's things like that if I wouldn't have given that feedback on, that's the way it would be conducted. And I don't think the results would be as, standardized to how like it is in a normal setting for people with CF. And it would just be very burdensome because it'd be very draining and tiresome for me to try to do breathing tests before having done any of my treatments during the day. I think that's where, as a patient, we come in and are able to, tailor and modify these not only clinical trials, but any, patient-facing communications and materials too, to make it more understandable, to make it easier to participate, to make it more accessible. So that's what I do, and that's it really is my driver and my passion.
So you're just saying that the researcher is really, really dumb.
They get caught up in the way that they are used to doing things and the way that they think makes sense. But that's, yeah.
We got to give them grace, as you say.
You're right. Absolutely right.
Before I take the mic away from you, is there anything you want to say, promote any words of wisdom, the winning lottery numbers? The mic is all yours.
No, I think this has been a great conversation. I think we delved into a variety, really some variety of topics, and you really drew out a lot of important facts about my health and my care, and from professional to personal. So I really enjoyed this a lot, and yeah, I don't think I have anything else to add, but I really thanks for having me. Appreciate it.
Of course. You can follow Ella. Her Instagram is below her face right now, but her links are in the description below. Thank you, Ella, for giving me your time and your expertise. Thank you, everyone, for listening and watching, and I'll see everyone next time. Bye.